Hi, I'm Grant Wilson, Surgical Technology Program Director at Calhoun Community College.
Hi, my name is Carla Crate. I'm your Surgical Technology Instructor at Calhoun Community College.
Performance of basic skills is important for anyone that is working in a surgical scrub role. Today we're going to have some of our students help us by demonstrating a proper surgical hand scrub. The members of the sterile surgical team should complete the pre-scrub activities in preparation to performing the surgical scrub. First, inspect the skin of your hands and forearm. The fingernails should be kept clean, not extending beyond the fingertips, and artificial nails should not be worn. The skin of the hands and forearm should be intact, with no burns, lesions, abrasions, or cuts present. If there is a break in the integrity of the skin, the surgical team member should determine if the extent of the damage to the skin prevents performing the surgical scrub and participating as a member of the sterile team. All jewelry, including rings, bracelets, and watches, should be removed prior to the scrub. Adjust face mask and protective eyewear to ensure optimal function and comfort. Select from available scrub brushes and FDA-approved scrub solutions. Scrub brushes come both dry and impregnated with scrub solutions. Choose one that works well for you and your skin type. Open the package and place it aseptically within reach. Turn on the water and adjust the temperature. Pre-wash the hands and forearms with antimicrobial soap. Note that the surgical team member should perform a standardized surgical scrub procedure based upon manufacturer's written instructions that are specific to the scrub solution to be used and according to healthcare facility policy and procedures. The anatomical time method or counted stroke method of performing the surgical scrub are both acceptable. The surgical team member should follow healthcare facility policy. Today, we will be demonstrating a 5-minute anatomical timed surgical scrub. The surgical team member should follow the general principles of completing a surgical scrub. The areas under the nails should be cleaned with the use of a disposable nail cleaner under running water. The nail cleaner should not be discarded into the scrub sink and should be disposed of according to healthcare facility policy. The scrub should begin at the fingertips and end 2 inches above the elbows without returning to a clean area. The fingers, hands, and forearms should be visualized as having 4 sides or planes that must be thoroughly scrubbed, including the web spaces between each digit. The scrub starts with either hand. Use the nail brush to clean the cuticles. Be sure to scrub each digit, including the webbed spaces. Scrub front and back of the hand. Repeat the same procedure with the opposite hand. Use an S pattern to advance to the forearms of the same arm, then to the forearm of the first arm, and then to the elbows. This allows for the scrub procedure to advance from fingers to elbows without returning to an area already scrubbed. Note, hands should be kept up and higher than the elbows throughout the scrub procedure so that the water runs from the fingertips toward the elbows. If possible, when water is not in use, it should be turned off to conserve. If additional scrub solution is needed, it may be added by using an automated dispenser. Continue scrub to a point approximately 2 inches above the elbow. Take caution to not touch your hand to the sleeve of your scrub shirt. The scrub brush should not be discarded into the scrub sink and disposed of according to healthcare facility policy to prevent cross-contamination of the scrub sink. Rinse with hands up and elbows down in a forward motion. Do not go backwards. Bring your hands up and out with a turn of the body to avoid hitting the sink faucet. If scrub solution remains on your skin, you may repeat the rinse in the same fashion. Maintain a proper arm angle with hands up and away from your face and elbows down and away from your body. Proceed to the operating room. Open the operating room door without contaminating your hands or arms. After entering the OR, you should thoroughly dry your hands and arms using Aseptic Technique prior to donning a sterile gown.